Earlier this week, we introduced you to Megan White, a young Letcher County woman who has dealt with diabetes most of her life. We also introduced you to her mother, Amanda Smith. Today, we will take a look at the newest insulin pump giving hope to thousands of diabetics. WYMT's Kassidy Stricklett is in the newsroom to continue her series. Cass?
Steve, the MiniMed 670G from Medtronic may sound like medical terminology to us, but to thousands of diabetics, it's a device they have been waiting for. Manufacturers and doctors are calling the new insulin pump the artificial pancreas. Megan White was one of the first people in our region to get the pump. I went to Huntington with White and her mom a few weeks ago as they learned how to use the pump. A day years in the making.
I've been looking forward to this for so many years.
Megan White visits the doctor in Huntington every few months, but this time is different.
You can see that both pumps look really similar, which makes it nice because this is going to be an easy transition for you.
This time, she's training to use the MiniMed 670G, the latest insulin pump that doctors say will drastically change the lives of thousands of diabetics.
With this new pump, we don't have to check it as often, and you have better results. So we get better blood sugar numbers, and you don't have to worry about having these severe low blood sugar reactions that often can lead to hospitalizations for kids, because the pump actually prevents the lows from happening, which is pretty amazing.
Dr. Bales says his office was one of 20 centers to start working with the new pump in the spring. Since then, the results for patients have been amazing.
We've had tremendous results. Everyone that's had it so far has done better. Their hemoglobin A1Cs, which is the kind of average blood sugars, have gotten a lot better.
He calls the pump the biggest advancement in diabetes technology in 20 years.
I do think really within the next 5 to 10 years, everyone that has type 1 diabetes that has a pump will have a pump that's an artificial pancreas that can actually make adjustments on its own based on the blood sugar data.
An advancement drastically needed to help many in Appalachia.
This is one of the highest incidence of type 1 diabetes in the world. This little area of eastern Kentucky, southeastern Ohio, and southern West Virginia.
Tens of thousands of diabetics are currently on the waiting list to get the new pump. White was one of the first in our area to get hooked up to the device.
I hope other diabetics can get this, and I just know it's going to be a life changer, not just for the diabetic child or an adult that gets it, but, for their loved ones as well.
As for White,
it's just been, we've went through so much to finally be able to get this artificial pancreas, and I hope it helps me a lot.
She's just thankful for the chance to feel better. Now, as I mentioned before, this doctor's appointment and training for Megan's new insulin pump was a few weeks ago. So tomorrow, we will check back in with Megan to see how the insulin pump has affected her everyday life. Make sure to tune in tomorrow at 6 to learn more about the changes she has seen. Steve?
We'll look forward to it. Thank you, Kassidy.